We've heard multiple warnings in the last few days that the NHS is facing extreme pressure this winter and on multiple fronts. So what do the figures show? One measure of the health service performance is A&E waiting times, which have increased dramatically over the last 2 years. In November 2022, more than 37,000 people waited more than 12 hours in A&E before being admitted to a hospital department. That's 34 times higher than it was at the end of 2019. The latest figures show there's also been a sharp increase in the number of people having to wait over an hour for an ambulance. Look at the red line, that's 2022. On Christmas Day, the latest day for which we have data, more than 1 in 7 people waited more than an hour for an ambulance. That's almost 10 times higher than in 2021 and 17 times higher than in 2020. Demand for beds is also higher because there are more long-term patients than any of the 3 previous years. Take a look at the third graph over here. It shows over the past 4 years the number of beds taken up by people who've been in hospital for more than 3 weeks in the week leading up to Christmas. Last year it was almost 25% higher than it was in 2021 and 60% higher than it was in 2020. So why is demand so high? It's at least partly because of the pressure created by rising flu cases. Let's look at the flu admissions in the week leading up to Christmas in 2021. There were just 34 people in hospital with flu each day, and only 2 of them required critical care. Now let's look at the week leading up to Christmas in 2022. There were 3,746 patients each day in hospital with flu, with more than 260 of them in critical care beds. So we're seeing more than 100 times more people being hospitalised with flu and requiring critical care in the run-up to Christmas compared to the year before. And that's all happening as the health service faces a staffing crisis. As of September 2022, there were more than 133,000 job vacancies across the NHS, and around 11% of those vacancies are in nursing, with the Nurses' Union saying poor wages and working conditions are why so many are leaving the sector. Now, the government says it's doing all it can to relieve the strains on the health service. But with multiple NHS trusts declaring critical incidents, a winter of industrial action and the pressure of flu and COVID cases, it seems the NHS is in for a challenging start to the new year.